but there is real substance behind that trendy-ness, and that's some of what I wanted to share with you today. This gentleman was mentioned in the morning. John Kabat-Zinn was a molecular science PhD in MIT in the late 70s. He happened to go for a lecture just like this, but it was 5 people listening to a Zen master in MIT. He got inspired by that. He went out and became a monk for almost 4 or 5 years, learned the Zen philosophy. Then in the early 80s, he came back and he said, no, I'm a doctor. He had trained to be a doctor. He went to the University of Massachusetts Internal Medicine Cancer Clinic. In those days, internal medicine cancer was overlapping. And he said that your terminal patients who have nowhere to go, allow me to work with them on the mental side. And he started what later on became the MBSR, mindfulness-based stress reduction clinics. And even today, most of those papers that were published, they acknowledge John Kabat-Zinn's contribution to bringing a spiritual practice into mainstream modern medicine. So this is now reimbursed by Medicare. And if you listen to some of his lectures, he says it's really funny. We just sit in a room and do nothing, and we get paid for that. Because it actually has results. It brings a lot of results on mindfulness. Somebody was asking in the morning, does it work? So there is hard scientific data to show that it improves outcomes, it reduces stress, it improves healing. So there's a lot of clinical data to support that mindfulness actually works. And in a business sense, you know that is true when the insurance company starts to pay for it. That means it actually works, because it takes a long time to convince an insurance company for that. So it is now a part of mainstream medicine and science. And a lot of this adventure has started because of this tool, what we call functional MRI. Now, MRI is an imaging technique, and that's static. But what we do in functional MRI is run certain sequences which can track where the blood is going. And the brain has a system called autoregulation, which means that the blood will go wherever most effort or most neuronal activity is happening, right? So this is what happens when hand movement is going on. So the guy is sitting in or lying inside the MRI machine. The scientist has asked him to tap his hands, and that area of the brain lights up. So this is almost like a living tool where you can put a volunteer inside a machine and start to say, so the earlier studies were about move your hand, move your toe, do some mathematics, or there's a sensation that is coming on your finger, we'll see which part of the brain lights up. All of that was the simplistic stuff. The stuff that I've written here is what is being studied now. So you can, and I think Mo mentioned this study about meditation masters. They are asked to go inside the machine and say, okay, now meditate. Or now don't meditate and let's see what happens to your brain, right? So there are actual papers published in journals like Nature and Science on what is the neuroscience underlying compassion. What happens, there are psychological studies being done where choices have to be made which are moral or immoral. People in settings have even ordered killing of their own colleagues in certain experimental situation. And then fMRI is being done to see why did they make that choice? Which part of the brain was working when these choices were made? So after many years of reticence, in fact, when I was practicing neurosurgery, a lot of this stuff was a black box. We did not know what actually happened in the brain. And especially things like consciousness were not scientific. They were not, I wouldn't say they were not scientific, they were not open to scientific inquiry. But because of this tool, because you can now actually study what's going on in the brain when a lot of these things are going on, people are saying, and this is a quote from a paper, that after many years of reticence, scientists are no longer wary of exploring the stream of consciousness.